Hello everyone, welcome to Renix Academy. Our tutorial for today, our OSCE procedure for today will be on immediate care of a newborn. I am your tutor, nurse, midwife, surgery for Victoria, and I'll be taking us through the steps involved in caring for a newborn immediately after birth. Of course, immediate care of a newborn, from the words, we should know that they involve the steps that are taken to help a newborn, to support a newborn transition to the extrauterine life. You know, the life of a newborn while in the placenta is different from when the baby is being given birth to. So how do a baby adapt? How is a baby being cared for when the baby is born? So the very first thing is to perform our hand hygiene as usual. You perform your hand hygiene, you dry your hands, you don your gloves. So it's a clean procedure, so you can put on your examination or your conform gloves. So let me relate us to our instruments. Of course, we'll be using our bulb syringe, our umbilical cord scissors, our arm bag and mask. We'll be using vitamin K and a needle to withdraw vitamin K for prophylaxis. Then our pulse oximeter to check for oxygen saturation and pulse rate. Then this is like a receiver for the secretions. Then we have our baby's wear. We have our towel and that. So let's go basically into the procedure. So the very moment when the baby is being delivered, as a midwife, so the very first thing is to provide warmth. So it's a two-way thing. It's either we do a chest to chest, there's something they call kangaroo mother care, right? So we bring the baby chest to the mother's chest, so that can create warmth. But if that is not possible, we can bring the baby here under the radiant warmer. That can also create warmth, and we can as well use our towel to dry the baby and as well to wrap the baby. So we dry the baby, then we wrap the baby. So wrapping the baby in a towel is already providing one of the best warmth you can think of. So we can decide to off our radiant warmer while we use the towel. Okay, so ensure the baby is well wrapped, the head is well covered. Yeah, thank you. So after warmth has been created, the next thing will be airway clearance. So we are going to clear the airway. Put the baby in a neutral position that can open the airway, and you take your bulb syringe and your receiver, your gallipot. Then you suction. You suction the mucosal secretion inside the baby's mouth, which might be as a result of maybe the baby has soaked in meconium from the mother, or any form of secretion at all. So we go into the mouth, we suction, we expel, we suction, we expel. Can also go through the nose. So the next procedure is called clamping. So we have to cut the clamp. So the cord has been clamped, but we are going to cut it using our umbilical cord scissors and the gallipot to just receive it. So as you can see, the cord is being clamped 2 to 3 centimeters away. So ours is to cut the middle, right? The middle. So just like 1 centimeter away from each other, just cut. So after cutting, you can make use of your cord clamp to keep it alive. So that's it. The cord clamp. So next is ABGA score. We are going to be checking for the appearance of the baby. Of course, we know the meaning of ABGA, the pulse rate, the appearance of the baby. How is the baby? Does the baby appears pink or blue? Is the baby cyanosed, or the baby is well? Then we check for the activity of the baby as well. Is the baby work flexed, or the baby is just flabby? And another thing, we also check for respiratory rate. As the baby breathing, is the baby breathing normal? Then we check the Grimes. Grimes is talking about the reflexes, the voluntary reflexes. Can the baby respond to sucking reflexes? All of that. So that's for ABGA score. And ABGA score is checked in 1 minute and 5 minutes. So it's checked in the first 1 minute and the next 5 minutes. So after checking for ABGA score, you clean up the baby very well. Then you weigh the baby on the weighing scale and you check for the necessary vital signs. Then after that, after the patient has been cleaned and all, you weigh the patient, you put on the baby's clothes. And after doing all of that, when the baby is well dressed, you initiate breastfeeding immediately. You take the baby to the mother. When the baby has been dressed up, the next thing is to administer prophylaxis vitamin K sometimes, and any other prophylaxis like erythromycin injection to prevent conjunctivitis, that's ophthalmia neonatal. Then you can also apply chlorhexidine gel to the umbilical cord, as prescribed. So this is vitamin K. Usually 1 ml is given intramuscularly at the baby's thigh. So ensure you do it very well. So after administering vitamin K, you ensure you identify the baby by wrapping the baby with identification card showing the date the baby was born, showing the time, as well as showing the sex of the baby and showing the name of the baby to prevent any form of confusion or any form of ethical dilemma or any form of mix-up of a baby. So after doing that, you check the vital signs and continue to monitor the baby's vital signs. And after that, you record all your interventions and care. Then you take the baby to the mother to initiate breastfeeding. Ensure breastfeeding starts immediately before the first 1 hour of birth. Ensure the mother starts to breastfeed the baby. It helps in growth and development, and also helps in the expansion of the lungs as well. And very important is teaching the mother how to latch, how to correctly breastfeed a baby. It's very, very important. After doing all of that, you discard your gloves, you perform your hand hygiene, then you take your instrument back to the treatment room. Thank you.